Welcome to this episode of Nursing Edge Unscripted Saga, where we journey through the history of nursing education using stories that connect the past to the present and then our future as we reimagine our teaching and learning. August is the birth month of Isabel Hampton Robb, an extraordinary nurse, author, and strategist who transformed the course of nursing leadership in the early 19th century. She led a movement to organize the profession of nursing at a time when women's work was not valued and the moral integrity of nurses' work was not fully established. Her story is the story of the birth of modern nursing in the United States. Isabel was born in Ontario, Canada in 1859. She enrolled in the Bellevue Hospital Training School for Nurses in 1881 and became one of the first graduates of a Nightingale Model Training School in the United States. In 1886, she was asked to assume the role of superintendent of the Illinois Training School for Nurses in Chicago, another Nightingale program. Her reputation as a strong leader quickly spread, and in 1889, she was appointed the superintendent of nurses and principal of the training school at the new Johns Hopkins School of Nursing. Right from the beginning, she instituted reforms. She extended the nursing program's length from 2 years to 3, while also establishing an 8-hour workday for nurses. It was in this position that she published one of the first nursing textbooks, Nursing, Its Principles and Practice. For the next 2 decades, there was tremendous growth in nursing education, but curricula lacked rigor and standardization. Superintendents across the U.S. had the difficult task of counteracting a belief that nursing, often considered to be a role women were born to, did not require formal training or education. The superintendents realized that by organizing, they could collectively work to advance nursing and nursing education. With this understanding, in June of 1893, at the occasion of the 1893 World's Fair in Chicago, Isabel Hampton chaired a group of superintendents to meet and discuss a collective vision for nursing in the United States. They met in the Great Hall of Columbus in the Women's Building at the fair. Together, they set about laying the foundation for a new association, the American Society of Superintendents of Training Schools for Nurses, the society that would become the National League for Nursing in 1952. Through the efforts of dedicated superintendents, the society worked to overcome the tarnished image of untrained, unkempt, and uneducated nurses. The training schools with strong leadership were interested in the quality of life for students and graduates and sought better conditions for both, and in doing so, made significant contributions to the Americans' public health and well-being. In 1894, Ms. Hampton left Johns Hopkins to marry Dr. Hunter Robb. Florence Nightingale, always a strong supporter of her educational reform initiatives, sent the wedding bouquet. Mrs. Hampton Robb moved to Cleveland, Ohio with her new family and used the opportunity to work with the Lakeside Hospital Training School, which eventually became the nucleus of the nursing program at Case Western Reserve University. There, she wrote 2 more classic nursing books in 1900 and 1907, Nursing Ethics for Hospital and Private Use, establishing the roots of contemporary ethical practice, and educational standards for nurses, leading a reform movement to inspire faculty and training schools to develop a standard curriculum that advanced both theory and practical knowing. Continuing her advocacy for nursing, Mrs. Hampton Robb became active in promoting standards to advance nursing practice. In 1896, she served as the first president of the Nurses Associated Alumni of the United States and Canada, which later became the American Nurses Association. She also played roles in both establishing the American Journal of Nursing to disseminate best clinical practices and in creating the first postgraduate collegiate program for nurses at Columbia University. Tragically, Mrs. Hampton Robb was killed in a Cleveland streetcar accident in 1910 as she crossed the street to attend her son's dance recital. She was only 49. At that moment, the nascent nursing profession in the United States lost its strongest advocate. Organized nursing honors her today with awards that continue her legacy of promoting leadership, perseverance, and innovation in the nursing field. These awards are given by the National League for Nursing and the National Student Nurses Association, and are among the most prestigious nursing commendations a nurse or nursing student can receive today. Isabel Hampton Robb, a giant in nursing, she led a movement to reform healthcare by bringing excellence and integrity to nursing education. She led with purpose and tenacity to shape a transformative future for organized nursing, for nursing education, and for the nursing profession. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.